Uh, this video is regarding salivary gland, particularly about the parotid gland. Parotid gland is the major salivary gland, and here is the parotid gland. It is basically present between the mastoid process and the external acoustic meatus. External acoustic meatus is visible here, whereas the mandible is not visible from here. So this is the parotid gland. It is actually a pyramidal shaped structure. Its base is directed superiorly, which is related to the zygomatic arch here, whereas its apex is directed inferiorly or present just behind the angle of the mandible. So this is the parotid gland which is visible from the surface, whereas this parotid gland is actually embedded in within the external acoustic meatus uh, and the angle of the mandible. So here it is. So this is the cross section or transverse section of parotid gland. Here you can see this is the mandible, actually ramus of the mandible in cross section, and this is the muscle which is called medial pterygoid, and here is the muscle which is called masseter muscle. So parotid gland is actually some of its part is embedded within angle of the mandible and mastoid process. So here you can see actually the facial nerve is passing through this gland and dividing the gland into superficial part. This is lateral one, superficial, and the medial part, and this is actually deep part of the gland. So if you look at this diagram here, from after exiting from the stylomastoid foramen, this nerve passes through the substance of the gland. Here you can see the substance of gland. Now the one thing which is important to note that actually facial nerve divides into two parts. One is the temporofacial and other cervicofacial branch, which later on divide into five branches: temporal branch, zygomatic branch, buccal branch, marginal mandibular branch, and cervical branch. So this facial nerve is also called queen of the face. So as you can see that this facial nerve is passing through the parotid gland. It does pass through the parotid gland, but it doesn't give its nerve supply to the this parotid gland. So here you can see there are certain borders. This is anterior border of the parotid gland, this is posterior border, this is the medial border, whereas this surface is superficial surface, this here surface is the anterior medial surface, this is posteromedial surface. So in other diagrams, this gland also has got capsule, which is very thick and tight capsule. Deep fascia is absent in the face, but it is present in this parotid gland. So here you can see this capsule is derived from the investing layer of the deep fascia. Here you can see the in the red one or pink one, maroon one is deep fascia of the neck, which is investing layer. This is sternocleidomastoid muscle again of the right side, sternocleidomastoid muscle of the left side, trapezius muscle of the right side, trapezius muscle of the left side. So the fascia upon on this parotid gland is basically derived from this investing layer. Now look at this parotid gland, it actually overlaps the masseter muscle. Here you can see the masseter muscle. This parotid gland, this green one is the parotid duct. This parotid duct just 1 inch below the zygomatic process, it runs parallel to the zygomatic process on the masseter muscle. When it reaches the anterior border of the masseter muscle, here is the anterior border, it turns sharply medially and pierces the buccinator muscle, and after piercing of the buccinator muscle, it actually opens into the vestibule of the mouth against the upper second molar tooth, or maxillary second molar tooth in the form of small papilla. So this is the parotid duct of the gland. So this is the parotid duct of the gland. So this is here you can again see how facial nerve is passing through here. So anterior medial relation of the parotid gland would be masseter muscle, ramus of the mandible, then medial pterygoid, and lateral relation on the superficial surface would be skin, superficial fascia, a few of the lymph nodes, and greater auricular nerve. Now, this is the transverse section of the gland. Here you can see this is facial nerve, white one. Then we have got D part of the gland. Then we have got superficial part of the gland. This is superficial surface. This here is the anterior medial surface. And here comes the posterior medial surface. So this is ramus of the mandible again. Here you can see the masseter muscle, and here you can see the medial pterygoid. So the purpose of showing you this diagram is you can see there is a red structure passing through the substance of gland, the blue structure passing through the this substance of a gland, then facial nerve passing through the substance of a gland, and there are few lymph nodes which are superficial. So these structure pass through the substance of a gland. So they are present, they pierce the gland and pass through its substance. So this red artery is actually external carotid artery. External carotid artery, when it is about to divide into the superficial temporal artery and the maxillary artery, and this blue one is the retromandibular artery. In a while I would be showing you where exactly this gland is located. So this is again facial nerve which divides the gland into deeper and superficial part, then lymph node. So my mnemonic for remembering the arrangement of these structure is that a very fat lady, for artery which is external carotid, very for vein which is retromandibular vein, fat is F for fat, F for facial nerve, and lady for lymph node. So structures which are passing through the substance of a gland are a very fat lady artery, vein, facial nerve, lymph nodes. Artery is external carotid, and vein is retromandibular. So here you can see this retromandibular vein. This is here you can see the retromandibular vein, how it is being formed. Retromandibular vein is being formed. This is superficial temporal artery, and here comes the superficial temporal artery, maxillary artery. They join to form the external carotid artery, or external carotid artery actually divides into superficial temporal and maxillary. So this is the exact location where this division is actually taking place within the gland. Okay. So nerve supply of a gland, this nerve supply is very much important. As you can see, this is inferior salivary nucleus, which is the parasympathetic component of a glossopharyngeal nerve. Then this blue line is representing, this red dot, blue dot is preganglionic neuron cell body, and then this blue line is whole preganglionic neuron axon. Then this dot, blue dot, is again postganglionic neuron cell body, and then this interrupted blue line is representing the postganglionic neuron of the postganglionic neuron fibers. So again inferior salivary nucleus, then glossopharyngeal nerve, then tympanic nerve, then tympanic plexus, lesser petrosal nerve, aortic ganglion. From aortic ganglion it synapses with the postganglionic neuron here, then axon of the postganglionic nerve through auricular temporal nerve reaches the parotid gland. So again, see, inferior salivatory nucleus, glossopharyngeal nerve, tympanic plexus, lesser petrosal nerve, aortic ganglion. From aortic ganglion, with the help of auricular temporal nerve, fibers reach to the parotid gland, whereas sympathetic, these are secretomotor fibers, and parasympathetic fiber is lateral horn of the sympathetic outflow, then anterior motor root, then through after passing through white rubus communicantes, fiber enter into the sympathetic chain, then in superior cervical ganglia, it synapses with the postganglionic neuron. Now you can see the line is also has become interrupted. So postganglionic fibers, they reach their destination after in the form of peri-arterial sympathetic fibers, and they make plexus around the artery and reach to the gland. So secretomotor fiber, vasomotor fibers, and whereas sensory innervation is through great auricular of the capsule is through great auricular nerve, which is a part of this is great auricular nerve. This nerve supplies at the angle of the mandible to the skin, and also supplies the capsule of a capsule of this parotid gland. And here is the it is a branch of cervical plexus. Here you can see. So this is again same diagram. Here you can see this is inferior salivatory nucleus, and here is the glossopharyngeal nerve. This dotted red line you can see. Then tympanic nerve, then tympanic plexus, lesser petrosal nerve, aortic ganglion. From aortic ganglion via auricular temporal nerve, the fibers reach to the parotid gland. So this was a bit review or quick review regarding nerve supply and about the gland, and their lymph drainage would be in the preauricular lymph node from their deep cervical lymph nodes. Thank you very much.